conventional medicine is like mopping the floor every time the roof leaks, but functional medicine is asking, why is the roof leaking in the first place? Sounds silly, but I think it highlights how silly it is to not be looking at what is actually driving a disease rather than just masking it with prescription medications.
Welcome to Beyond Beauty, where confidence meets care. Join us as we uncover the art, science, and soul behind today's most refined cosmetic treatments.
Thank you for tuning in today to our Beyond Beauty podcast. I'm joined today by Dr. Rachel, our integrative and functional medicine expert. Thank you for joining us, Dr. Rachel.
Thank you for having me.
So, what is our topic today?
Today, we are demystifying functional medicine. So, what is it, who's it for, and why is it gaining so much attention?
So, what led you to functional medicine?
So, functional medicine was something that came to me when I was working as a family doctor and finding that I was just handing out prescriptions to patients and they weren't really getting better. And it just started to not make much sense to me because we weren't really treating the root cause of my patient's symptoms. So I was burning out really fast and I ended up kind of doing some self-research and I realized that there's a better way to approach these things.
So, how did this realization impact your practice?
Well, I started digging into different root causes of disease. So things like genetics, nutrient issues, inflammation, hormone imbalance. And once I started kind of addressing these root driving causes of disease, I actually saw my patients start to get better. And that was really the first time in practice that happened. So it really encouraged me to keep learning more about functional medicine and kind of unlearn some of the things I was taught in medical school about how to best approach common conditions.
Did you have a personal health concern that kind of you used the functional medicine approach as yourself as a patient?
Yeah, absolutely. So a few years back, I was suffering from really severe migraines multiple days a month. And obviously, you can imagine as a doctor, it's pretty debilitating. And I was using a lot of pharmaceutical prescription medications just to get through the day. And I kind of approached myself through the functional medicine lens, looking at all the different layers. So for me personally, it involved addressing some food sensitivities, looking at my gut health, addressing toxic burden, fixing some nutrient deficiencies, specifically B vitamins. And, slowly but surely over time, as we sort of peeled back the layers of the onion, I got a lot better and almost to the point where I haven't had a migraine in years now.
Wow, that's fabulous. So, what would you say is one of the biggest myths about functional medicine?
I think one of the biggest myths is that it's sort of like alternative or woo-woo, like it's all about like crystals and vibes, but it's really not. It's very scientific and data-driven. It builds on conventional medicine. We still do all the same lab testing, imaging, but we also expand on that and do kind of testing that is more cutting edge. So things like microbiome analysis, micronutrient testing, genetic testing, these are all things that haven't yet been incorporated into conventional practice, but are completely based in scientific principles. So we use these tests to sort of provide a more comprehensive approach to managing people's conditions.
Is it kind of like naturopathy?
That's actually a really common misconception, and I would say it's not the same as naturopathy. There's a few similarities, but really functional medicine is still rooted in conventional medicine. As I was saying, it just sort of expands on conventional medicine, and we're utilizing more advanced diagnostics, and we're using a lot of data to personalize and customize our treatment plans for patients.
So it seems like there's some potential gaps in conventional medicine.
Yeah, I think the biggest gap in conventional medicine is really the fact that it's only treating the symptoms of the disease. We're not getting to the root cause of it. So, like you can think about it like this. Conventional medicine is like mopping the floor every time the roof leaks, but functional medicine is asking, why is the roof leaking in the first place? Which sounds silly, but I think it highlights how silly it is to not be looking at what is actually driving a disease rather than just masking it with prescription medications.
So what would this look like in practice?
So it can look different depending on the patient and the condition. But for example, a cancer diagnosis, it's not just about chemotherapy. It's about supporting your body through the chemotherapy. So this might involve looking at your sleep, your stress, your nutrient levels, preparing your body for undergoing such a treatment. That's really the functional medicine approach, is much more comprehensive than just a single pharmaceutical treatment.
Wow, okay. So for somebody listening who feels like their health concerns have just been dismissed, where would they start?
And this is super common, that people feel dismissed by their practitioners, and that's because, maybe their labs all look so-called normal, or they don't fit into some neat and tidy diagnostic criteria. So my first advice to people experiencing, symptoms that can't be explained is to track them for patterns. So are they worse at certain times of day? Is it related to eating? Is it related to your menstrual cycle? This basic observation that you can make can give a lot of really valuable information. Uh, Second, I would suggest finding a practitioner that can help you with all of this, either a functional medicine doctor or integrative practitioner, or really just a doctor that's willing to ask questions and be curious and ask why, and not just try to give you a diagnosis as a label. And lastly,
I think you need to get the basics under control.
yeah, getting the basics under control is super important. And that's always a starting point that I emphasize to patients, where if you're not getting enough sleep, if you're not eating properly, having balanced blood sugars, if you're not breathing properly, you're not going to get the same results from more advanced treatments and supplements and IVs. You really have to get the foundation right first before you can really start to get better.
All right. That's fascinating. Thank you so much for joining us today. And thank you for tuning in. Please don't forget to subscribe and look out for our next podcast.